I'm Dr. Chen Zhao from University of Pittsburgh. Today, I will talk about HPV-negative cervical cancer and precancers lesion. Learning objective, epidemiology, and clinical significance. Of course, everything about HPV-negative cancer, histopathological feature, reason why the negative HPV test. This study published in 1999 from New Zealand. The study included more than 900 cervical cancer tumor blocks. They purify the DNA from the block and do the several different PCR. Finally, they get the conclusion HPV DNA was detected in 99.7% of the case. So now get the conclusion HPV is the necessary cause for all cervical cancer. So since this paper, everyone think the HPV involved all the cervical cancer, people always think in this way. In fact, it's not true. There are several other more studies. This is the largest study from 38 countries, include European, American, Asia, a lot of different countries. The database is huge, include more than 10,000 cervical cancer. You can see clearly the squamous cell carcinoma HPV detection rate about 87%. Cervical adenocarcinoma HPV detection only 62%. Overall, 85% for this study. Remember, this largest study is published in the Lancet Oncology 2010. This study from United States CDC, from California, they do the study, the purpose for HPV vaccine. So this very seriously designed test. Also, they include the first line, almost 800 cervical cancer. You can see also the tumor block, purified DNA, do the PCR, HPV positive rate, you see here 90%. We know that in the United States, the cervical cancer type, what type of cervical cancer? People think squamous cell carcinoma account for 70 to 85%, adenocarcinoma account for 15 to 30%, depend on the literature. Okay, remember the adenocarcinoma 15 to 30%. This study published in the Modern Pathology, this is worldwide sample collection from worldwide. This is the case number 682 cervical adenocarcinoma. I can see here the HPV positive rate 63%. In other words, almost 40%. Cervical adenocarcinoma HPV negative, not detect HPV from this study. This study from European, this multiple nation study, also 461 endocervical adenocarcinoma. The HPV detection rate about 76%. This study from China, the multiple hospital study, also you can see almost 600 endocervical adenocarcinoma HPV detection rate about 72%. So we will talk about HPV positive rate, depend what type of specimen. So in above all the specimen I mentioned, the study was tumor block. This means pathology have the cancer block. They purify the DNA from the block, then do the PCR. The second type of specimen, the liquid sample from cervical cancer patient. This patient in the hospital, they know the patient had the cervical cancer, then take the specimen, do the HPV testing. You can see still for this study, about 10% cervical cancer case, HPV detection is negative. This previous study, this HC2 at that time. Now the third type of the specimen, HPV testing history of cervical cancer patient. This one is the most important. This means patient has histology diagnosis, cervical cancer. Before that, 6 months, 3 months, 1 year, patient had HPV testing result. So when we check, we see this kind of specimen. I first do this kind of study, this published in the archive in 2012. That's been 12 years ago. This is UPMC McGee's data. You see in the study period, 287 cervical squamous cell carcinoma. At that time, remember 10 years ago, very few cervical cancer, the patient had HPV testing result. See, I find 3 of 31 HPV testing result negative, 10% within the 1 year. At that time, I was working as a CAP set committee that I organized study involved 18 academic hospitals. You see the cervical cancer, 53 cervical cancer case. Within the tissue diagnosis within the 1 year. Before tissue diagnosis, almost 10% patient had HPV testing negative. 1 to 3 years, before 1 to 3 years, 23% case HPV negative. This large study from United States, Quest Diagnostics, they involved many labs. You can see the first line, the squamous cell carcinoma 310, the HC2 test 11% negative, adenocarcinoma 27% HPV negative. This is the 2 large study recently published study from 2 largest women hospitals in China. I involved study this the HPV testing method, HPV genotyping, involved 18 high-risk HPV type. You see, put together here, this largest squamous cell carcinoma, adenosquamous cell carcinoma, totally 2,781 cases. You see the HPV positive rate 94%. This means tissue biopsy, this within 6 months. Basically, most of the patients had HPV testing within 1 or 2 months. 6% cervical squamous cell carcinoma HPV test negative. Adenocarcinoma 18 positive, in other words, 20% case HPV testing method. Why? Why this previous HPV testing negative for this cervical cancer? We once did a study. This means the patient cervical cancer, then within the 1 year, patient had flu HPV testing negative. For this case, then we from the cervical tumor block, we purify DNA, do the PCR. You can see, remember this HPV testing, the fluid HPV testing is negative. Then you can see from tumor block, 44% HPV positive. So from this study, we can see the truly HPV negative cervical cancer and also the false negative. This means you do the liquid-based cytology, at the same time do the HPV testing, the negative, but the tumor block HPV positive, then we see false negative. This is a very interesting study from Sweden. There are 2,850 cases. You see 394 cases, HPV detection by PCR is negative. Then they do the HPV sequencing. Then 43% of this PCR negative case, they detection the HPV sequencing. So their conclusion, some cervical cancer contain HPV that is difficult detected by PCR. This paper published from the Barcelona, Spain, make the diagnosis. They think the HPV-negative carcinoma of the cervix is a distinct type of cervical cancer with a poor prognosis. Remember, poor prognosis. You see, this study, they found 10% cases, their cervical cancer HPV negative. Compare with the HPV positive cervical cancer, their clinical prognosis is poor. So this is an interesting study. Now we talk about adenocarcinoma, endocervical adenocarcinoma. Long time ago, we know the endocervical adenocarcinoma HPV positive and also HPV negative. HPV negative, the endocervical carcinoma, including the most common the gastric type and the clear cell carcinoma, endometrial, mesonephric type. Remember, all this most of this type of the cervical adenocarcinoma, they are HPV negative. Okay, thank you for listening.